Tell me about high blood pressure. Why is it called the silent killer? Is that legit?
Yes, I think it is, because sometimes people will have symptoms when they have high blood pressure, but for the most part, they won't. They will not know at all.
So it can be there for a long period of time, causing damage, and people not know it?
Absolutely.
How do they find out?
They find out because they've stumbled into their doctor's office and maybe somebody's measured it, or maybe at Walgreens, or maybe because they've had a complication from high blood pressure.
Now, if somebody suddenly says, well, your blood pressure is a little high today, do they tend to try and push that aside, or does the doctor try and say, hey, we need to pay attention to this?
I think it's well to pay attention to blood pressure that's a little high, even if it's high normal in that pre-hypertension phase, because we know that that can go on to be higher and higher, and over time definitely contribute to some bad problems.
So tell me, what is a normal blood pressure?
Well, if you wanted to say technically normal is less than 120 and less than 80, but
when you say less than 120 and less than 80, what are you talking about?
the systolic and the diastolic blood pressure.
What's the systolic? Let's go through that.
Well, when your heart, which is a pump, when it squeezes and pushes blood out through the arteries, that pushes blood out and that increases the pressure. And
So
that's
that's
that
the highest
upper
pressure.
number, that systolic pressure.
Okay, that's systolic.
And then your heart relaxes so it can fill with blood again. And during that period when it's relaxing, that's diastole. That's the diastolic pressure in the blood vessels where the blood isn't being pushed through them.
So 120 over 80 is quote, quote, normal?
Yes, and that's pretty much what we would consider kind of ideal, you might say. But we don't really talk about high blood pressure until it's about 140 and 90.
So what if somebody has a low blood pressure, let's say 100 over 60, is that bad too?
Well, it depends on the situation. There are a lot of younger folks running around out there, especially young women, who naturally have low blood pressures. And if they feel well, that's good. But if you are getting older and you've got some other medical issues, that's a blood pressure that I'd be concerned about, because it may lead to some trouble if it's too low.